Well, hello. It's Bruce Williams again. It's the 3rd of May. Still indoors, but it's time for another growth path challenge. Slide number 1 is tissue from a turtle. Can you name the condition? And can you give me 2 rule outs for the white material that jumps out at you in this image? Okay, time's up. This is a classic case of a condition that we see in reptiles and birds who normally excrete uric acid. This is known as articular gout. You can see the white material is concentrated in the joints of the hind legs. Now, gout comes about in 2 ways. One, it's primary when the animal is oversupplemented with protein. We see this a lot in reptiles in zoo collections or pet reptiles where people really want to keep them on a high plane of nutrition, but you can sort of overdo it. Second possibility is secondary gout. This is unlikely in this case. That generally precipitates along the serosal membranes, usually result from an insult to the kidneys to prevent the animal from excreting the uric acid or dehydration. The 2 rule outs for the white material, number 1 is urates or urate monosodium hydrate. The second possibility is a condition that's known as pseudogout. And this is not urates at all, but it's calcium pyrophosphate. Pseudogout has been identified in a number of species of turtles and in a wide variety of other animals, including mammals. Sometimes it will precipitate it in the muscles, where it's known as tumoral calcinosis. Slide number 2 is tissue from a cat. Can you give me a morphologic diagnosis? Okay, time's up. I'm not sure what happened to the thyroid in this picture, but the one that's there certainly is rather large. My morphologic diagnosis would be multiple thyroid adenomas. It may be one big one, but the nodular appearance of the thyroid and the number of these I've seen, usually there are multiple large expansile nodules in there. You may have hyperplastic thyroid tissue in between, sort of getting crowded out. Some people like the term nodular adenomatous hyperplasia. I'm not a big fan of that. I'm going to come down on adenomas. The reason that cats get this, and there are a number of reasons, usually they have something that turns on the TSH receptors in the thyroid, whether it's autoantibodies to TSH with shit on the receptor, pretend like it's turned on, or there is a genetic abnormality where that TSH receptor is always turned on, so it is constantly trying to secrete thyroid hormone. I also want you to notice how big the parathyroid gland is in this particular section. About 75% of cats with hyperthyroidism also have hyperparathyroidism. Doesn't seem to be related to kidney failure, but it's just a very common finding. It probably has to do with the interplay between the thyroid and parathyroid glands. Slide number 3 is tissue from a calf. Can you give me a morphologic diagnosis? Okay, time's up. Looking at one of the cardiac valves here, and you can see these somewhat bloody cysts on the valves, and these are known as hematocysts. Hematocysts are incidental findings. They don't cause any problem, and they're usually a result of a little defect in embryological development of the valve. What happens is that as the valve develops, you have small vessels in there that supply blood to the developing valve. And the last thing that happens is you have an endothelial covering that's laid down over it. And sometimes it will trap some blood in there over time, and you have this little bloody cyst within the valve. And over time, that the products will break down. The valve will become less and less noticeable, and eventually the fluid is often resorbed and you never notice it. That's why we see them only in calves, and not that many calves have them. So it's usually absolutely not a problem This is not a case, it's not shaggy, so I wouldn't look at it as a case of valvular endocarditis. And the fact that I said that this was a calf should clue you in that this is one of these incidental findings known as hematocysts. Slide number 4 is tissue from a sheep. Can you give me a morphologic diagnosis and a cause? This is an absolutely fantastic picture. Thanks from Dr. Helen Ackland of the University of Pennsylvania. And what we're looking at is nodules throughout the parenchyma of the lung of the sheep. They are raised and they have sort of a gray, greenish appearance. The entire lung looks a bit meaty. Morphologic diagnosis is multifocal to coalescing, granulomatous and eosinophilic pneumonia. If you want to put with diffuse interstitial pneumonia, that's fine as well. Usually this particular condition starts out with just nodules along the dorsal surface and maybe especially in the caudal dorsal lobes. This is lungworm infection in sheep. Goats tend to have, they don't tend to have these nodules as much. They tend to be more of a diffuse interstitial pneumonia. And as we said before, the nodules start up over the large airways of the caudal dorsal lobe, but eventually, as the infection gets worse, it spreads down over the lobes themselves. The two lungworms that you want to know in sheep and goats is Mullerius capillaris and Protostrongylus. Protostrongylus, the adults live in the airways. In Mullerius, they can be all mixed up in the airways and sometimes in the alveoli as well. But just a fantastic case of Mullerius capillaris in this sheep. Slide number 5 is also from a sheep, and this is from a lamb. Can you give me a morphologic diagnosis? Okay, time's up. This is an excellent picture of a polycystic kidney. Now, polycystic kidney comes in 2 basic flavors. You have the dominant form, also known as adult dominant polycystic kidney disease. We get that name from human medicine. And you get the recessive forms. I think they look very different. They act very different. And this is a great illustration of one of the recessive forms. This animal was probably delivered stillborn or died shortly after birth. There is sort of a regularity to the cysts in the kidney. Almost every tubule and glomerulus is markedly cystic. There's no fibrosis here. To me, it looks sort of gel-like. And you can see kidneys that look like this in foals, in cats, and in people. So this is the recessive form, and this is one where the kidney is very enlarged. There's no functional tissue available even at birth. And these kidneys may be so enlarged that they cause an enlargement of the animal's abdomen. If you've seen other polycystic kidneys, especially the dominant form, which is common in certain breeds of cats like Persians, these animals live for a number of years. And their kidneys, when they're born, are fairly normal, but over time develop huge cystic tubules and or glomeruli and a lot of fibrosis. But the animal takes a number of years to progress to chronic renal failure, whereas these animals with the recessive forms that look like this are pretty much dead on arrival, unfortunately. So I think that's a nice explanation of recessive versus dominant forms. It's held up for me over the years. We are on slide number 6 already, and this is tissue from a pig. Can you give me a morphologic diagnosis and 2 possible causes? Okay, time's up. This is the ear of a pig, and we have diffuse pinal cyanosis with marginal infarction. That's a good one. I can also say that this is multifocal coalescing pinal vasculitis with dermal and epidermal infarction. The outer part of this pig's ear is infarcted, okay? It's not just hemorrhagic, it's sunken. You can see straight edges here. So we're looking at, whenever you see straight edges, you gotta think that something is occluding a vessel. It is obstructing the dermatome. And this is not an uncommon lesion in pigs that have a severe vasculitis. Two possibilities I would think about are non-host adapted Salmonella, Salmonella cholerae or Salmonella typhus. Okay, both of those, instead of causing the severe diarrhea and enteritis that we think about with Salmonella, they are a disseminated vasculitis. And so you will get infarction of the extremities, as well as you will get vasculitis all over the body. You will get a typical gram-negative sepsis appearance with areas of necrosis and abscessation in the spleen and the lymph node and mesenteric nodes. So that'd be a good one. The other one is an agent that we know causes vasculitis in pigs, and that would be erysipelathrix rhusiopathy. And I would expect this pig maybe to have other skin lesions as well. Whenever I think of that kind of vasculitis, I always think of porcine circovirus 2, which is well known for causing vasculitis in pigs in a number of organs. So I'm even going to throw in porcine circovirus in this one. So you got 2 salmonellas, 1 erysipelathrix, and 1 PCV. Pick 2 of those. I think you got some really good rule outs for this. If you said frostbite, I'm seeing a really nice pattern here for vasculitis rather than frostbite. We don't see a whole lot of frostbite now because most of the pigs are factory farmed and they don't go out and get into freezing weather. So let's think about Salmonella and erysipelathrix when we see these infarcts anywhere in the animal skin. Slide number 7. It's time to practice our big doctor words. Can you give me a morphologic diagnosis for this lesion? Okay, time's up on this one. I'm not going to ask you for a cause. I don't know the cause. Well, it could be a couple of things, but I want to make sure that you know what you're looking at here. We are looking at the base of the skull and the base of the spinal column. The dorsal vertebral arches are gone, as is the spinal cord. Here, the top of the cranium's gone, as is the brain. So we have a bunch of things going on. The morphologic diagnosis would be craniorachesthesis. This is cranioschisis here. This is rachesthesis here, loss of the dorsal vertebra, with anencephaly and amyelia. So we've lost the cerebrum, at least, and possibly more. And we have also lost the, at least this segment of the spinal cord. Is this spina bifida? Is certainly as bad a case of spina bifida as you would want to see. I think that rachesthesis with amyelia probably covers it pretty well. What caused this? You know, there's a lot of things that have been incriminated in the dog. I don't know of a lot. You can get genetic forms of spina bifida in certain breeds of dogs, like bulldogs, anything with a very short tail. You could see that. In humans, it's been associated with folic acid deficiency. In species like ferrets, it's been associated with these neural tube defects with defective migration of cells. One thing that you will always see with these severe defects is you will see a failure of the muscle growth and the skin growth over this. Remember, everything around it takes its cues from the formation of the cranium and the spinal column. So if that doesn't form, there's no stimulus for the muscle or the skin to form over it. That's why we get these great lesions of spina bifida in a variety of animals. Slide number 8 is tissue from a dog. Can I have a morphologic diagnosis? Okay, time's up. We're looking at the stomach. Some of the things going on is very red. It's, you have some what appear to be bile staining here, and then you have nodules within the rugae of the stomach. One's been open for you. You can see that it's full of cells. And when you see this, this is gastric lymphoma in the dog. I would not think about a gastrointestinal stromal tumor or smooth muscle tumors when you have this many nodules. They are this superficial and not within the wall of the stomach. It's a very nice picture of gastric lymphoma. Slide number 9 is tissue from an ox. Can you give me a morphologic diagnosis? And 5 possible causes. Okay, time's up. I was just being mean there. Usually I ask for 3. Okay, we are looking at multifocal to coalescing subendocardial mineralization. A lot of ways that you could get into that. You could talk about ventricular and atrial mineralization, but certainly it is affecting both. There's a couple of diseases in the ox and a couple of plants that you need to know. There are a number of plants, and you see a fair amount of toxicity, especially in certain parts of South America with these plants that contain vitamin D analogs. Remember that vitamin D is used in the intestine to open the gates for calcium. So if you get an analog of activated vitamin D, there's a long process and you have to do a lot of things to get it activated in the body. But if you're eating a plant that has something that looks like it and is activated, you're going to get a lot of calcium that's normally not absorbed, be absorbed, and it's going to precipitate out of solution because the calcium levels are so high, even in the face of fairly normal kidneys. Now, these kidneys are probably going to go bad soon because kidneys tend to get heavily affected by forms of metastatic calcification. Remember, anytime your calcium multiplied by your phosphorus level is over 70, you're prone to develop metastatic calcification. In the ox that are eating these plants, the heart is one of the last things to go. Usually it starts in the tendons. The animals will hobble around, then it will affect the musculature, usually of the front of the animal first. Then you'll start to see metastatic calcification in a range of other organs, including the kidneys, the vessels, and this is an extension of that. The heart is usually one of the last things to become affected. So when you see this, you know that this is sort of an advanced case. The plants that you probably should know are Cestrum diurnum, Tricidum flavescens, or Solanum malacoxylon, which I believe has been renamed, and I can't remember the new name. I've known as malacoxylon for many years. We just had a case in the Wednesday Slide Conference, so if you're really interested, you can look that up. There are a couple of other Solanum species that will do this. This has also been attributed to alfalfa, but so many animals eat alfalfa in the world. I always had trouble believing that one, but smarter people than me have figured that one out. Okay, so there are these plants that have the analogs. The other two things that we see are the possibility of lymphoma. Lymphoma will cause hypercalcemia. It's one of the hypercalcemias of malignancy in cattle. So you can see this and associated with lymphoma, and is often seen in the left atrium. Okay, that's sort of particular. The last possibility is Johne's disease. Anytime you have severe granulomatous inflammation, you can also have endocardial mineralization. So that's 5 possibilities there, actually 6 if you include alfalfa. Vitamin D toxicity. Whereas you can see vitamin D toxicity in show animals who are given a lot of vitamins, and horses, it's really tough to do it in a cow because you can pump as much vitamin D as you want orally. It tends to get all bound up in the rumen. So they're less susceptible than horses to vitamin D toxicosis. I'm going to leave you with another ox. Tissue from an ox. Can you give me a morphologic diagnosis? Okay, we're looking at generally the white part of this animal. There's a large ulcerated mass on the side of the vulva here. Because it's in a white, sparsely haired area, this, until proven otherwise, is going to be squamous cell carcinoma. Remember, the cattle get a lot of squamous cell carcinoma if they have white skin. They tend to be UV induced, often around the eyes. A lot of these squamous cell carcinomas start out as plaques, and at that point, it's thought that even 50% may regress. So they start out as a plaque, then the body either responds to it appropriately or it gets out of hand, resulting in the formation of one of these large tumors, especially bad around the eye, but I can't imagine this one was a good one either. So squamous cell carcinoma of the vulva in a lightly pigmented and lightly haired area. Well, that brings us to the end of Ghost Path number 73. Hey, I want everyone out there to take care of yourselves. Most importantly, take care of the people around you. Okay, wear your face mask. You're not wearing it to keep yourself from being sick or getting sick. You are wearing it to protect the ones you love. With that, I will see you all tomorrow with another Ghost Path challenge.